have like no major substance abuse history, and then they have a medical provider that wants to give them that medicinal marijuana card, I usually encourage it as long as so that they can avoid going into the criminal justice system if it will help them stay in complete probation without having to violate.
Okay. Thank you guys very much. Another question that's come up is Black Americans are more likely to be uninsured or underinsured. How does the mental health system address someone who needs culturally affirming care but can't afford out-of-pocket therapy rates?
I will say that there are not a lot of there are a, there are not a lot of things that the system does as a whole, but there are a lot of clinicians and practitioners who utilize resources, community resource community resources sometimes to help address that problem. So one of the organizations that I work with as a clinician is called the Center for the Equitable Access and Treatment of Trauma, and it is a nonprofit organization, and it's based in Miami, Florida. And what we did was we had a grant from the Carrie Meek Foundation where we were able to, what the our population was the uninsured, underinsured in Miami-Dade County who were either survivors of or witnesses of some type of gun violence. And of course, from there, it had to grow to just any type of trauma because we had lots of dollars in order to try and help fill in that gap. But one of the things, just as we went talks about in the beginning, that the stigma associated with seeking mental health care, it is heavy in um, communities where there is high poverty, so we had a hard time actually getting participants because
Hmm.
people were, anti-therapy or they'll come to, therapy and they have three of their friends, it was all virtual. We were 100% telehealth, but they have friends there and they didn't want to comply or they only wanted to come just for a minute, and they didn't want to follow through the program. So you know, there's sometimes there are community health centers and other resources that will see uninsured or underinsured, but it's very difficult because those spaces usually have, long wait times, high burnout, high turnover of clinicians because they don't generally pay as well. So, because I was just doing this with another group of, Black women clinicians, it was a little bit different, but it's still very hard to sometimes overcome the stigma associated with mental health, especially in the Black community. So there are programs that exist, but it's still now there comes well, how do you get the people to actually want to come and get that help? Because, there's just a natural distrust with systems by lots of Black people for very good reasons.
I could jump out on that because I work in the criminal justice system. There is, even though someone may not have any money or may not be able to afford mental health counseling, culturally sensitive counseling, like with someone that's Black, or if they what I would like to tell our viewers tonight is that even though you may be seeking community mental health treatment in the community mental health provider, you can ask for a Black therapist, a male Black therapist, or a female Black therapist. It doesn't mean that, I mean, if they don't have it available, then they may not have it available, but you can ask, and if they have someone available, that will definitely help out on that end in terms of like not having money to be able to afford who you want to go to. But when you do go to places that um, deal with you, if you're like indigent or you don't have the money, they can if you ask, if they have it available, they'll make sure that they connect you with a Black female therapist or a Black male therapist if that's what you want. And sometimes those are the ones that are more culturally sensitive to your situation because they know your situation. But there's also our white counterparts that have gone through training and learn about their own biases that will help them treat Black folks as well. So, but I always encourage clients like if you want that kind of service, ask for it. I mean, nothing could. go wrong with you asking. And if they don't have it, then just ask for somebody that's been culturally trained to understand what Black people go through so that you don't have to explain yourself so much in therapy sessions.
All right, we have this one here. We might have touched on this earlier. As someone who struggles with isolation and feeling alone and felt like they had nobody to talk to, where do you actually find your people? Was it online, therapy, church, gym, etc.? Where do you go to find those connections?
I think it just depends on the person and the things that I think also, and if you're not sure, I think also trying different things, being able to feel comfortable, being uncomfortable. That's the only way that we can grow when we're uncomfortable. So I think just taking the time to step out and maybe trying different things or trying different hobbies that you normally haven't done before, and our support groups, depending on what you might be going through, to find those people that can probably relate to you or relate what's going on. And so I know for me, just being able to find a group of people to probably run with or work out, because that's something that I like to do. So if you focus on the things that do make you happy, that motivates you, that gets you out of there, especially if you're feeling lonely, that isolation, because that can be difficult, is finding just a good circle that's going to motivate you every day. And then I just encourage to try different things. I encourage to be uncomfortable, and to be able to work towards those feelings so that you can come out of it, and just doing different things to find different people to surround yourself with for support groups.
I think that it's one of those things where it can be a little bit of a fine line issue, though I can imagine, because if you work on this idea of let me go where have people that have like common interests with me,
Mhm.
things that I'm interested in. Well, you might like drinking, and it's
That's
like,
true.
right. And then it's like, well, you go and find people who like drinking,
That's
and
true.
you might end up exchanging one issue for another now, that you
That
kind
is
of
true.
poured into drinking, and that's become so it's one of those things where I imagine it has to be a little bit of a fine line, and I can see how that could be problematic for some. But I think
Mhm.
it's emphasis on one of the things that you said, which is like things that motivate you, positively uplift you,
Mhm.
and having enough insight, right, to be able to
Right.
recognize that even if I do like drinking, this is probably not a situation where I should try to find my people that way at the risk of overindulging and, like I said, creating another issue for myself. Yeah.
Absolutely. I appreciate you saying that. And I think, and also going where I say drinking probably makes you comfortable, right? And so going
Mhm.
where you're
Mhm.
uncomfortable. Something that,
Right.
and being and being
Yeah.
uncomfortable can be in like, all right, now I gotta go in an environment where we're all drinking tea, water, and this is very uncomfortable, but you might find your
Yeah.
support group there. So no, I appreciate that. And you definitely have to
Yeah.
have insight. Absolutely.
Absolutely. Yeah. Absolutely.
If
Gotcha.
I can add
All
a
right.
little bit to that,
Mhm.
typically what I try to tell clients that are dealing with loneliness or isolation and stuff like that, I always tell them that you have, in order for you to get out of that situation, you have to do the opposite of it. So if you're dealing with a lot of major depressive symptoms, I always tell them like, well, if you feel like laying down all day, you don't want to shower, you just got to push yourself to do the opposite until you start feeling comfortable doing the opposite, where you can get over some of those situations. And there's also things like clubs, like video game clubs, online, or you could do church, or you could do